Hi, my name is Michelle Lyons, and I'm the local health director from the health department. Today, I'm here to give you a presentation on Hansen's disease, which is also known as leprosy. So you might wonder, what is Hansen's disease? So Hansen's disease is an infection caused by a bacteria called Mycobacterium leprae. The bacteria can grow very slowly, and it may take up to 20 years for a person to develop signs of this infection or this disease. Usually, Hansen's disease affects the nerves, skin, eyes, and lining of the nose. When it attacks the nervous system, a person can lose the ability to sense touch and pain, which can increase their risk for having severe injuries that become infected because they cannot feel it. So how is Hansen's disease transmitted? So the exact cause is unknown at this time. However, scientists believe that it's transmitted via droplets. So an infected person coughs or sneezes, and then a healthy person breathes that in, and having the close contact can cause transmission. Also, if a person has prolonged exposure with an untreated person with Hansen's disease, they can also develop it as well. And then in the southern United States, 9-banded armadillos are naturally infected with the bacteria. So they believe that it is transmitted from armadillo to humans who are handling those armadillos. I think it's very important to know that Hansen's disease is not passed from mom to baby during pregnancy, nor is it transmitted sexually. So with that information, you might wonder, who is most susceptible to Hansen's disease? So overall, the risk of getting Hansen's disease is very low for adults, and that's because more than 95% of all people have natural immunity to Hansen's disease. So that 5% of people who lack the gene and don't have that natural immunity are more susceptible. People who live in crowded conditions just due to cleanliness are at increased risk. And then there is a higher prevalence in people aged 5 to 15 years, or if you're over 30 years. People who live in resource-limited countries, and some of those countries that they have found a high prevalence rate are India, Brazil, and Indonesia. So how is Hansen's disease, what are the signs and symptoms? How is it diagnosed? So a person with Hansen's disease may develop patches of skin that look lighter or darker than their normal color. They also may become red. They might develop that loss of feeling because it's attacking their nerves. The only way to confirm the diagnosis of Hansen's disease is for a doctor to take a biopsy of the affected area and then look at that under a microscope to confirm if that bacteria is there. The incubation period for the bacteria on average is 5 years. However, symptoms can occur within 1 year, but can, like I mentioned before, can also take up to 20 years or even more. So what are ways that we can treat or prevent Hansen's disease? If you're diagnosed with Hansen's disease, it is usually treated with a multi-drug therapy consisting of 2 or 3 antibiotics. And the reason for the multi-antibiotics is to prevent the development of antibiotic resistance. Treatment can be kind of lengthy. It lasts between 1 to 2 years. And Hansen's disease can be cured if treatment is completed as prescribed. And an important note is patients become non-infectious once they've taken a few doses of their treatment, so they don't have to be isolated away from family and friends, which is nice. Ways to prevent Hansen's disease: avoid contact with bodily fluids from an infected person, and then if you can, avoid contact with armadillos. Currently, there is no vaccine to prevent Hansen's disease. However, the vaccine to prevent tuberculosis does provide some protection against leprosy, and it can be helpful. And then here are my references if you want to look up any information. And thank you so much for listening to my presentation. Have a great day.